We can talk about set point first. Like what are some of the reasons why a woman's weight would continue to increase over time? And then I'd like to kind of flip that around and talk about brain fog.
You raised this point about the adipostat, the set point, and I think this is a really important topic because, what I found as I tried to navigate my 30s, and I imagine this is true for a lot of our listeners and viewers, is that I had my first baby at 32, and I had my second baby at 38, and it was so hard to lose the baby weight. I mean, first of all, I gained too much because I have a food addiction tendency, and when you're pregnant, that's when you just
I'm eating for two.
Yeah, you think you're eating for two. It's like, no, you're eating for 1.05.
I know, it's so true.
Yeah, so I gained all this weight, and then all the usual tricks that I had in terms of exercise and cutting calories and even cutting carbohydrates just didn't do the trick when I was trying to lose the weight postpartum. And so we know that that's a really vulnerable time. But even for women who haven't had children, what we know is that there tends to be this kind of steady increase of gaining weight. And unfortunately, especially over the age of 40, it tends to be more fat mass and less muscle mass, which also, disrupts that body-brain connection. So the adipostat starts to change, and the way that the adipostat, or the set point in the brain, works is that it closely monitors your calories, probably your macronutrients, and makes adjustments in hormones, downstream hormones, such as ghrelin, the hormone that tells you to pick up the fork, and leptin, so that your appetite is supposed to be closely regulated. But what I find in a lot of my patients is that the adipostat gets jammed. And I certainly experienced this in my late 30s, where I just was hungry all the time. And it was very hard to manage until I started to address the hormonal root cause, which in my case was related to leptin and insulin and ghrelin.
It's interesting. I find most of the women, just as an aside, sort of a clinical pearl, I find that most of the women that I work with, they have some degree of leptin insensitivity, meaning that when they should be putting the fork down, as you said, so ghrelin is the thing that makes you, pick the fork up. Leptin is the one that makes you put the fork down. Like, okay, I've had enough. There's one, they will overconsume calories to the point where the leptin action on the hypothalamus in the brain is just not there. And there's been quite a few studies that are actually quite old. And when I first found these, I couldn't believe that I hadn't heard of them earlier. But literally, for every measure of BMI, every measure of body weight, women compared to men, women have more leptin insensitivity. So they will consume more calories at that any given level of obesity. So we are just exquisitely sensitive, I think, to becoming more leptin insensitive just by proxy of being a woman. And I can't tell you why that is. It could be that we have more adipose tissue, but leptin is secreted from the adipose tissue. So it's just this down regulation from the hypothalamus maybe you have a better explanation that I haven't come across yet, but
I don't have an explanation, but I want to validate what you just said, because I certainly see this in my practice. And I think, if I put on sort of my Paleolithic ancestral hat here, it makes sense to me that women have kind of this more tightly conserved adipostat and have this bias toward gaining weight compared to men.
Yeah.
So, I wish with the adipostat that you could just kind of take it on and, start exercising in a certain way, like with high intensity interval training and not chronic cardio, start eating the right foods, and then you can just, get your set point back to where you want it. But the truth is, for women, there's this bias where it's asymmetric, meaning that it's so much easier for women to gain weight than it is for them to lose weight compared to men. And so there's a number of reasons for that. I think the key reason is we evolved as women to have more fat, to be fertile, to have, sort of this evolutionary pressure to keep producing our hormones that support our menstrual cycle. And the key hormone there is luteinizing hormone. So we want to make enough luteinizing hormone so that we're ovulating every month. And we know that if you calorie restrict, it can keep that luteinizing hormone from pulsing, from spiking the way that it's supposed to in the middle of your cycle around day 12 to 14. So I think that's part of the reason here, why there's more leptin resistance when you compare BMI between men and women. I think it's also, this is a different topic altogether, this is my next book, but I think it's also one of the reasons why women have much more difficulty with a ketogenic diet compared to men. So that's a super juicy little bomb that I'm going to drop in the middle here.